Okay, my video is in now. Good evening, everyone.
Good evening.
Please, if you can hear me, just unmute and then let me know if we are all aligned.
Yes, we can hear you.
Okay, that's fine. So you can hear Jerome calling me Akuya. My name is Akuya Chanwi, and this evening is just the one that, and I think many of us have heard it from all angles and all places. But people will be wondering what glaucoma is. And this evening we are here to talk about glaucoma and then its effect and how we can prevent it and even early detection. Very, very important. So that's what we are here for this evening. And it's from none other than one and only Robert and Sons Limited. It's one of the leading eye clinics in Ghana and beyond. They have a lot of branches in Ghana, and then they are doing a whole lot. When you talk about Robert and Sons, it's just a single company with and a common business name, you know, and they deal in eye testing, vision screening, treatment and consultation, and then there are good eye specialists there who are ready to assist you anytime. You know, if you can see me, the spectacles I'm wearing, I got it from Robert and Sons. At a point, I wasn't really getting along with my phone screen. You know, when the brightness is too much, I get headaches. So I just walked into one of their branches at Adabraka, and then they sorted me out, and it's really, really helping me. So it's a trusted brand, trust me. And then today we are here to talk about glaucoma, and then we have a specialist, Osman Junior Metala, who is going to be a speaker, and then he's going to take us through glaucoma and then the do's and don'ts, how we can prevent it. Mr. Osman, if you can hear me, kindly say something so that my audience will know that you are around, you know.
Hello, good evening, everyone. I'm Dr. Junior Muritada, and I'll be the one to assist you guys with knowledge on glaucoma.
Okay. So thank you so much, Dr. Osman, for giving us heads up that you are here. And then I can see Andrew Sobobi. Obobi, if you can hear me, say something before we continue. Audrey Ama, please, if you can hear me, say something. Amdala Pegla, if you can hear me, say something too. Isaac Koshi, Joyce Esiedu, Junior Yusuf, Kafui, I see you, my sister. And then Louis Selby, MAB2 is here, Umamba Hamdia is here, Peter Kinopay, and Sylvester Nyama, and then we have Tammy Porter. So I think it's a good number, and then we can proceed. Quick one to Dr. Osman. Please kindly take us through what is glaucoma.
Okay. So glaucoma is a group of eye conditions that affects the eye. So when I say a group of eye conditions, there are several things that can lead to glaucoma. One of them being the eye pressure, one being other body conditions like hypertension and diabetes. So anything that damages the optic nerve of the eye. So there's a nerve that connects the eyeball to the brain. So when there's damage, there's a hole created on it and it dies slowly. Once that happens, then we say you have glaucoma. So glaucoma usually doesn't come with symptoms. Initially, when you have it in the initial stages, you don't have any symptoms until it has advanced enough for you to start to see symptoms. And even when the symptoms start, you may not notice them because it doesn't come with pain most of the time. It doesn't come with aches. It doesn't come with blurry vision until in the latter stages. So you may miss the signs. So in other words, we say glaucoma is a silent thief of sight because usually the symptoms don't come early.
Oh, wow. Very serious, right?
Yeah, it's a very serious condition that a lot of people take for granted.
So if you don't have symptoms and then you don't have signs that you are having glaucoma, who is at risk, if I may ask?
Okay. So a lot of things can lead to glaucoma. For instance, if there's someone in the family that has glaucoma, there's a high chance that another person in the same family has a condition. So one risk factor here would be hereditary. If there's a family history, there's a high chance that another person in the family has a condition. If you have a condition like diabetes, hypertension, sickle cell, and what have you, there's a high chance that you may develop glaucoma if you don't manage your underlying condition well. If you happen to be above the age of 40 years, there's a high chance that you may have glaucoma. If you were involved in an accident, yes. If you were involved in
It
an
means if we
accident,
are going above 40, if we are going above 40, should we be screened for glaucoma?
yeah, so not just people that are over 40. Like I mentioned, glaucoma doesn't really come with symptoms. So each and every one of us can have glaucoma without knowing. You can be born with glaucoma. So there are several types of glaucoma. You can, right at birth, you can have glaucoma. But the point here is that if you don't have glaucoma maybe in infancy and early adulthood, after age 40, your chances of getting glaucoma increases. If you have an underlying condition and you're on certain medications like steroids, maybe you have sarcoidosis, maybe you have arthritis, and you are taking steroids like prednisolone, long term, that can lead to glaucoma. The fact that we are all blacks, of the black race, is a reason why we can all have glaucoma. So being a black person predisposes you to getting glaucoma. That is one other thing that can lead to glaucoma. Another thing that can lead to glaucoma is the fact that maybe you were involved in an accident or you had a traumatic event and something hits your eye. That can increase your chances of getting glaucoma. So basically, those are the risk factors when it comes to glaucoma. There are more, but these are the common ones that you usually would find.
Okay, sorry I was cutting in at a point, but I guess you didn't hear me. And
Yes,
you
I
were
didn't
saying
get
that being a black, you are at risk of getting glaucoma.
Yes, so
I just need some explanation to it.
Yes, so research suggests that the black race, glaucoma tends to find it, we tend to have glaucoma amongst black people than Caucasians. So it's more prevalent among the black people. Harriet, can you hear me?
Yes, I'm here. I can hear you loud and clear. I can hear you. Okay, I just needed a little explanation to that. I wasn't really getting it. I'm like, hey, please, we can get glaucoma that easily.
So not the color of your pigments, your race.
Okay.
Yes.
So it means that those who are not blacks are not at risk. Is that what we are saying?
There are, but if you are a black person, you are twice as much at risk of getting glaucoma.
Okay.
Unlike someone being a Caucasian.
Okay. So right now we know that glaucoma doesn't have symptoms and signs, but how does it get detected? If I have it and it doesn't show any sign, I don't feel any pain, I'm just moving about, how can it be detected?
Okay, so even though there are no signs of glaucoma, there are certain types of glaucoma that may come with symptoms. And even the ones that don't come with symptoms, there are still signs, just that we may ignore them. For instance, if you should have glaucoma and you start to lose your vision, mind you, glaucoma doesn't take your vision from the front. It takes your peripheral vision first. So it's like it's taking this peripheral vision and it's closing up. The last thing it will come for is the one in front of you. As you are looking at me, in your background, even though you are not paying attention, you can see things around. If there are people moving around, you can see them without turning to look at them. For instance, again, if you are in the market, and then let's say Makola, for instance, you see how busy the place is. People sell on
Yes.
the aisle. You don't tend to look at them, but you're able to maneuver your way around.
Yes.
In the case where you have glaucoma, that peripheral vision that you are not paying attention to, but it's helping you, you lose that. So let's say you are walking in Makola and you begin to trip over stuff that they are selling on the aisle. It will never occur to you that you are not seeing. The first thing that will come to mind is that why are they selling on the aisle? They are not supposed to sell there. It will never occur to you that ideally I should see them, even though I'm not paying attention to it.
Yeah.
Another
Yeah.
scenario is, let's say you are a driver, you are driving and you get to a junction, and there's a car coming from the side. Ideally, you shouldn't tend to look at the car before you even notice that there's a car coming from the sides. But if that should happen and the car crosses you, the first thing that will come to mind is the person doesn't know how to drive. It will never occur to you that you should have seen the car even before it comes in front of you. So glaucoma takes advantage of the fact that we don't pay attention to that peripheral vision. And it steals it because we don't pay attention to our peripheral vision. When it's stealing it, you don't even notice that you are losing it. Because once you want to look at things to your side, you can just turn your head in that direction and you're able to see. So if you turn your head to the left and you don't see things to your right, it will never occur to you that I can't see things to my right because you are not paying attention to that. So even though there may be a sign, you are not paying attention to that
You are
sign.
not paying attention. Okay.
Yeah. So there are several types of glaucoma. There's the primary open angle glaucoma. In the case of primary open angle glaucoma, so let me explain how glaucoma occurs
Yes,
before I can go there.
can you break it down for us so that we will
Yes.
understand? I'm
So,
really enjoying the conversation. And please, sorry to cut in. Please, if you have any question, just put it there in the chat session, and then I'll read it out, and then Dr. Osman Jr. will answer all our questions because we are here for you. So just ask us any question about glaucoma, and in fact, about our eyes. Today we are all for the eyes. Let Dr. Osman help us with it. Okay, Doc, please kindly go ahead.
okay, so in the eye, there are several other sub tissues and then cells and other organs. So some of them had blood vessels. We all know that from basic science, it's the blood vessels that nourish our body, the various organs. But there are certain parts of the eye that don't have blood vessels. I'm sure you'll be wondering how they get their nourishment.
Yes.
Yes. So there's a fluid in the eye called the aqueous humor. It's like water.
Aqueous humor.
So the blood kind of cements this aqueous humor into the eye to nourish the parts of the eye that don't have blood vessels. And these parts are the cornea. It's a transparent organ. It doesn't have blood vessels. And also the lens, the natural lens inside the eye doesn't have blood vessels. So once this fluid nourishes the organs, of course, there will be excreta. It's like when you drink water, the kidney filters the water out and you urinate. So the same thing with the eye. Once the nourishment is done, the excreta should come out through something we call the canal of Schlemm. So this, I can liken that to, hello? Can you guys hear me?
Oh, I'm here. I can hear you.
So
my light just went off, so
okay, no problem. No problem. So this canal can be likened to a gutter. So in the case of primary open angle glaucoma, where the gutter is opened, but maybe there are some things that are choking the gutter. So when the filtration occurs and this excreta is supposed to come out, it's choked. So it's like you have an open gutter, but there's something that is blocking the flow of the liquid. So pressure builds up on the eye and it presses against the optic nerve. Then glaucoma occurs, then you lose your sight. In the case of angle closure glaucoma, the gutter is narrow. So the rate at which the drainage occurs is low. So there's also pressure buildup in the eye, leading to glaucoma. So in the case of primary open angle glaucoma, usually the symptoms are not there. There's no pain, there's no blurry vision, and whatsoever. But when it comes to angle closure, usually there's pain. You may have headaches or eye pain. In our part of the world, when you have headaches, the first thing that will come to your mind is, I have malaria. Let me go and test for malaria. It will never occur to you that maybe I have an eye problem or something. And sometimes they even tell you, go and drink water and sleep. So even when there's a sign of glaucoma, you may not notice. Most people think that if I should have any eye symptoms, then it should be vision related. The moment I begin to have blurry vision, then I know I have an eye problem. Any other symptom that has to do with pain, and the pain may be frontal headaches on your forehead or occipital headaches, or even your temples are aching. The first thing you guys will say is, I have a migraine. You may never think it's eye related. So even when glaucoma gives you the signs, you may ignore them and even start to treat other conditions that may not be related. So it's the reason why we still call it the silent thief of sight. So even though I said there are no signs, the few signs that are available, we don't pay attention to them because they are not directly linked to the eye. But when you have the case of advanced glaucoma, the moment it starts to take that peripheral vision, it narrows down to a point that you can only see straight ahead and not to your side. So if I should do this like a binoculars, any other thing outside my hands, I don't see. I only see straight ahead. It's like you're looking through a binoculars. Once you have advanced glaucoma, that's how you see. You see straight ahead, but any other thing that is not in your line of vision, you don't see it. That will be end stage glaucoma. So you see all right, but when you are walking around, you are bumping into stuff. That is when you would have noticed that you are losing your sight, and that would have been too late. Mind you, there's no cure for glaucoma, even though there's treatment. So the vision you lose, you don't get it back. When you come in, whatever we do for you is to buy you time, or should I say, prevent the disease from deteriorating, but not to give you the vision that you have already lost.
Okay. So it means that in the early detection, it prevents advanced glaucoma. Is that right?
Yes. So for instance, you can be detected of glaucoma at age 20, and by age 40, you may have maybe legal blindness or total blindness. So if you are detected at age 25 and you are supposed to be maybe blind at 40, if we detect it early and we put you on treatment and you are following the treatment regimen judiciously, we expect that you should be able to live a full life. The advanced glaucoma would have started happening maybe somewhere around your 70s. And we all know that nowadays people don't even live up to 70. And at that 70, it doesn't mean you are even going to get blind. That's when maybe you would have advanced glaucoma. And by that time, you would have been nearing your death. So what the medications and then the surgery is doing is to buy you more time, but not to give you your vision back. Hello, Harriet. Hello. Can anybody hear me?
Yes, I can.
Yeah, we can hear you.
I think I lost her.
Oh, okay. Let me connect to her and get in touch. Give me some few minutes to get in touch with Harriet.
Okay, sure.
Okay. Okay.
Hello, please, can you hear me now?
Yes, I can hear you.
I think the meeting ended and then it's thank you so much for enlightening us this evening. So I wanted to know, after the detection, what are some of the procedures in preventing advanced glaucoma? What some of the treatment that will be given to the person when it's detected? at the early stages?
Okay. So whenever you walk into any eye clinic, as part of the comprehensive eye test we usually do a preliminary glaucoma test for you. So we either do ophthalmoscopy or indirect ophthalmoscopy. So what it actually means is to shine light onto the eye to look at the retina and the nerve that glaucoma affects. We inspect it for signs of glaucoma. The moment we notice any signs, there are secondary tests that we usually will request that you do. The visual field test is one of them. So like I
Okay,
mentioned
visual field
earlier,
test.
visual field
Okay.
has to do with your peripheral vision. So when I say visual
Okay.
field test, it's just checking your peripheral vision to see the extent to which the condition has affected your peripheral vision. So we
Okay.
know where to classify you, whether it's early stage, middle
Okay.
stage, or end stage glaucoma. And there's
Okay.
another test that we do. So the visual field test is to check the function of the eye. So to check to see if you still have your peripheral vision intact. There's another test that we do for glaucoma, which is the OCT test, which is the optical coherence tomography. This takes pictures of the
Optical
nerve
coherence tomography.
and tries to compare it to the average person. When I say the average person, a normal person, then it will tell us how much damage has occurred on the nerve. So that's more like a structural test. So we compare the structure to the function to see if what is happening in the structure is actually portraying the same thing in the function. Once we do all that, we also check your eye pressures. Glaucoma usually affects the pressure in the eye, even though there are certain types of glaucoma that you would have and your pressures are still normal. But we check the
Okay.
pressures and then we now diagnose you to be maybe either having the early stage, mid stage, or end stage. Then after that, we look at the treatment options. There are several treatment options. We have
Okay.
medications that we give. Some of them are going to increase the flow of the fluid, the excreta that I mentioned. Others are going to reduce the production of the fluid that the eye produces. And
Okay.
some are going to do both, either increase the outflow and also reduce the production. And if these medications are not helping, sometimes we opt for surgery. And what the surgery usually does is to create another channel aside the natural gutter that I referred to earlier for the fluid to drain out, so that at every point in time, the pressures in the eye is within the normal range. So we try to maintain optimal pressures in the eye so that damage does not occur.
Okay. Maintain optimal pressures in the eye so that
Yes.
damages are not occur. We are talking about the silent thief of sight, which is glaucoma. And then I know that we are learning a lot from this session. And the sweetest part of it is that in as much as Dr. Osman is giving us all these insights this evening, Robert at Robert and Sons, we are ready with a 10% discount on screening for glaucoma and then any other eye sickness. But then we are treating glaucoma because it's one of the silent thief of sight. It has taken a lot of people's sight from them, and then they don't know. By the time you know, now agents are more crowded. So this evening we are educating ourselves, and then we are grateful that Dr. Osman is spending some time with us. Doc, continuing our conversation on glaucoma.
Okay.
You know, the affordability, can it be one of the reasons why people don't even want to go for screening or something, so that we know that Robert and Sons is going to give us discount, and then it is reducing all that burden from us?
Okay. Yes. Affordability is one of the reasons why some people don't do the test. I mentioned earlier that when you come in for a routine test, we do a preliminary glaucoma test, and that is usually part of the consultation. But when you are to do the visual field test and then the OCT, you have to pay extra. And sometimes, because of the extra pay that people have to dig into their pockets to get money from, they may end up not doing the test and then even don't come back for reviews. And by the time they come back, maybe they would have lost their sight or significant damage would have occurred. So finances is one of them. And I'm glad that you mentioned that there's a 10% discount.
Yes,
So at
yes,
least
yes,
it's
yes,
going
yes,
to offset part of the money that they would have been paying.
yes,
So let's
yes,
say if they were
yes.
coming in for visual field and OCT test, getting a 10%,
Mhm.
I'm sure it would make a difference. And
Yes.
also, sometimes when you come in and you are not even able to do the test, depending on the state of your condition, sometimes we go ahead and even start treatment before you come back and do the test. So don't let the price of the OCT, VFT deter you from coming back for review.
Mhm.
If you are not able to do it, even though it's ideal that we know where we are picking you from, so we can set a target for ourselves. Even if you are not able to do that, coming in to pay for regular consultations, and because when you pay the regular consultation, we are going to do the preliminary glaucoma test. We are going to check your eye pressure, which are all parts
Okay.
of the glaucoma test. So just by paying
Okay.
consultation, you enjoy that. At least half a loaf is better than none. It's better than saying that, oh, I'm not able to pay for the OCT and VFT, and you end up
Mhm.
not coming. And by the time you return, it would have been too late. Mind you,
Yes.
I said the vision you lose from glaucoma, you don't get it back.
You don't get it back. It's
So
forever.
the earlier you take your decision to come in and do an eye test, the better for
The
you.
better.
Yes.
Okay, 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 okay. So the earlier we take our test, the better, because glaucoma is silent thief of sight, and then once you the sight is taken from you, you can never have it back. I remember some time ago there were campaigns about glaucoma and all that. Some of us, we didn't really understand what it is until some time ago. I felt like maybe when I look a lot to the screen on my phone, I get severe headache. I was really alarmed. Doc, could it be a sign of glaucoma?
Oh, so that is something else. It's called computer vision syndrome. It's
Oh, okay.
unrelated to glaucoma, but that can be catered for with protective glasses. At Robert and Sons, if you walk in, we can do a test, a refraction, and then we get you the right glasses that would help you. It will protect you against the screens that you are working with. We are in the 21st century, and we can't do without these screens. So telling them to stay away from
Okay.
it is something that is impossible. So usually I advise that if you cannot stay away from the screens, then you can get the protective glasses to protect yourself. One other thing that I usually tell my patients is that you should take frequent breaks. There's
That is
something
very true.
called the 20-20-20 rule, which states that after every 20 minutes of screen time, you should take
Okay.
your head off the screen and look at something across the room, blink for 20 seconds, and then you get back to what you are doing. So 20 minutes of screen time, lift your head from the screen, look at something about 20 feet away from you. That's about 6 meters. Then you blink.
Okay.
If you can't estimate the 6 meters, just look at your colleague across the room and blink for 20 seconds. If you are not having a watch with you, you can just count to 20. If you don't want to do that, you can just walk to the bathroom and come back. At least you are
Okay.
taking a break from your screens. So that should sort you for the computer related issues. But how long can you go with the 20-20 rule? The best option would have been to get protective glasses so that you can sit on the screen for longer periods of time. Other advice that I usually give to people that use screens is to make sure that they have a good ergonomics. And when I say ergonomics, maybe how you position your screen, it shouldn't be upright. It should be a little tilted backwards. And then maybe your screen should be at your eye level. It shouldn't be below you and all that. That helps. But also having protection on makes it the best option.
Okay. Okay, Doc, thank you so much. Please, fellows, it's time for questions. Kindly drop any question that you have, and then Dr. Osman will be ready to assist you. I see you, Caroline, Bruce, Kathleen, LCL, Beth, Abednego, Blanks, and Sampa. Welcome to you. We are all welcome. Kofi Bismarck, you are welcome. Please kindly drop any comment or any question for Dr. Osman so that he can attend to us. Tonight it's all about glaucoma, and then we have about 19 minutes more to end things, and then or any contribution, any experience that you have. Maybe you're having a problem that you want the doctor to talk to you about, and then we can proceed from there. So Robert and Sons is really quite skeptical about this glaucoma, and then in Accra and beyond, they are everywhere. If you go to Adabraka, they have their head office there, just few meters away from Champion restaurants, and then they have one branch in East Legon, and they have one at Osu, Dankwa Circle, Adenta. We are in Tema, we are in Kumasi, we are in Koforidia. It's all about your sight. We say seeing is believing. Robert and Sons, seeing is believing. So,
Harriet, Yusuf's hand is up, so he wants to ask a question.
Okay, Yusuf, please kindly go ahead.
Okay, thank you for this opportunity. Good evening, everyone, once again.
Good evening.
Oh, good evening, yeah. So a quick one. So Doc, I want to know at what point or at what incident would you recommend us to use eye drops? I know ideally these should be prescribed by a medical professional, right? But looking at the case, we have these in our homes. And during random times, we tend to put these drops into our eyes without carefully putting into consideration what the issue is. I'm using myself as a case study. So way back, I've stopped that actually, but way back, anytime I feel some pains around my eyes, I just put the eye drops in my eyes. So I don't know if this is a best practice or not. I think this is something that we should pay much attention to because we have normalized this act. I don't know whether it's a best practice or not. So kindly do justice to me. Thank you.
Okay. Thank you, Yusuf, for your question. And I'm glad you actually asked this.
Okay. Doc, there's another question. I don't know if you want to answer this before we take it.
Okay, you can take that so that I can just answer both of them.
Okay, Carolyn Bruce Kathleen is asking, can cataracts lead to glaucoma? Can cataracts lead to glaucoma? So after you are done with Yusuf, we can touch on that too.
Okay, sure. So with Yusuf, he mentioned that people tend to do self-medication. When it comes to the eye, I always say, don't put anything on the eye if you don't see a doctor. Today, for instance, I had a friend come in, and I think on Sunday, he was cleaning the room, and a dust particle in the form of a stone entered the eye. He washed the eye, but he still felt like there was something on it. He went ahead to the pharmacy to buy some medications, and they sold him an eye drop. The eye drop did not do justice to his condition. That was on Sunday. Today is just exactly 2 days. When he came in, he had a sore on the eye because the stone that was on the eye was lodging on the cornea, leaving a sore. And the medications that he bought contain steroids. And steroids are not for conditions that have to do with the cornea. So mostly people go to buy medications at the pharmacy. Most of the people selling don't know much about eye drops and eye conditions. In Ghana, anyone can open a licensing shop. What's the name? A drugstore and get someone to sell medications. And even some of the pharmacists, when they are selling the medications, they don't even know the condition they are treating. They are quick to sell steroid-based eye drops. Not to say steroid-based eye drops are not good, but they have what we use them for. So when he came in today, the sore had become big and it was a deep cut. I am attempting to treat the condition, but because of how deep it is, if it should heal, it will leave a scar. And when you have a scar on the cornea, if it's medial, when I say medial, if it's at the middle part of the eye, it can affect your vision. And it's just 2 days of using the medication. He already has a sore on the eye. So I
So
always say,
imagine if it was 1 week or 1 month. I
yes.
think
So I always say,
his eyes
if you
would
have
have
any
been gone.
condition, walk into the nearest eye clinic for an eye exam
Yeah,
before
sure.
you start any medication. Make sure that it's prescribed. And you don't just walk into any pharmacy shop to get medication, or maybe even share your friend's medication. People are fond of doing that. Maybe one person in the household has Apollo and they come in, they get medication. The next day, one of the other siblings also has,
Everyone is using it.
and then they share the medication. Sometimes even sharing of the medication, you can transfer the condition to the other person.
To another person. Yes,
So it's
yes,
not
yes,
advised that you
yes.
share
I know
medications or you do self-medication. Even generally,
Okay.
not just the eye, because these medications have side effects and they have what they treat.
Yes.
So make sure you see a
Yes.
doctor, regardless of your medical condition, before you attempt to
Okay.
treat yourself.
Sure.
The second question, can cataract lead to glaucoma? Yes,
Yeah.
even though that is rare. In the case where you have a hyper-matured cataract and it starts to become intumescent. When I say intumescent, the cataract breaks and it leaks into the eye. It can lodge at where the water that I mentioned earlier drains out of the eye. It can lodge there and block the drainage. And that increases eye pressure. And that will press against the nerve that I was referring to earlier. And then you can get glaucoma.
Okay.
So it's possible, but it's rare.
Okay. Okay. Thank you, Doc. This
There's
one is
another
from
hand.
Junior. Okay. Okay. Whose hand is up? Mbamba Hamdia. Please kindly go ahead.
Hi, good evening.
Good evening, Hamdia.
Please, my question is, so with the medication, you see, sometimes you find yourself in some environments that you don't get easy access to eye clinics, and then you need the medication. Like me, for instance. Yes, I'm talking for myself. Currently, where I am, I hardly get easily access to an eye clinic, and then my recent eye drops, I just enter the pharmacy and then I have them. So does it mean I have to stop that? Like, and then I get,
Yeah.
and then with this glaucoma thing, it's like it's scary.
It's scary, right?
Yes. So
Oh, Doc.
so Mbamba, like even though you are in an area where you may not have access to eye clinics, there's still a way out. You can always practice what's the name? Safe methods, first aids at home. So let's say you have an itchy eye, you can always get water from the fridge and then you put it on the eye for the itching. And if you are having discharge, that's when most people tend to get medications from the pharmacy. Sometimes it's not all the discharge that you see that has to do with infections. Some of them is actually because maybe you are having dry eyes, or maybe you were exposed to maybe dust, and your eyes way of bringing out the dust is to come out, it will come out as a crust, something resembling a discharge. It doesn't mean you should just walk and then get medications. In a long time, I've not actually applied any medications to my eye. It doesn't mean that I don't have symptoms. Sometimes I just give it maybe a day or two to see if it will go away. If it's not going, then I go in to see a colleague to check my eyes out. So you don't always have to
Hey,
rush
Doc,
to get
Doc,
medication.
you to another person check your eye.
Yes, I can check my own eye, unfortunately. So I think last month
Oh, too
I
bad.
woke up with blurry eye. On my way to work, when I got to work, I had to let one of my colleagues check my eye for me, because that morning when I
Oh,
woke up, I noticed that one of my eye was a little blurry.
oh, too
So
bad.
that's
Okay.
even though I knew much about eye condition, I didn't self-medicate. I made a colleague check
Okay.
my eye for me. Someone would have just said, okay, because you know the symptoms, just go and get yourself some medications. I had my own ideas. Maybe I was thinking it was this particular condition or what that's particular condition, but I was not sure because I can't do an eye test on myself. I had to let a colleague check my eyes, make the diagnosis for me before I went ahead and got my medications. So
Okay.
It's not advised. It's not
Dear,
advisable
I think
wherever you
please,
are,
your question answered,
regardless.
Dear.
Yes, please.
And I
And
think right now, Robert
I think I have
and
another thing too. So
okay,
with the
okay.
blurry eye thing you just mentioned, does it mean no, you didn't say that, but I just want to be sure. Does blurry eye always mean it's a sign of glaucoma or like something?
Mostly when you even have blurry vision, it may not be glaucoma. Because if it's sudden blurry vision, most likely not glaucoma. Glaucoma is progressive. So it's not something that will just happen overnight. It builds up. That's why we are calling it the silent thief of sight. I mentioned earlier during the call that when you are losing your vision, you start by losing the peripheral vision, then it closes up to get the one that is in front of you. So it doesn't just get up one day and then take the vision away. It starts from the periphery. Then it takes 5, 10, 20, sometimes 30 years for you even to have the symptoms that you mentioned. That's the blurry vision. So even if it's taking the vision from the sides, you wouldn't notice. Because when you want to look at things to your side, you just simply turn your head. So whether you are seeing things your side or not, you don't pay attention to it, because ideally we pay attention to things that are in front of us and not the things in our background. So blurry vision usually is not a sign of glaucoma, because glaucoma tends to be a progressive condition, unless of course there was trauma to the eye. Maybe something hit the eye and it led to secondary glaucoma. That can actually cause blurry vision. But the one that we are all used to is gradual vision loss and not a sudden one.
All right, thank you.
You're welcome.
Okay, okay. Hamdi, I think your question.
Yes, please.
Any other question, please? Any other question from our participants, please? I know that you really learned something from the few minutes that is left here.
I have a question for Doug.
Okay, Jeremy.
Okay.
Go ahead, please.
So Doug, so if someone is watching or listening to us right now and has never checked their eyes before, what would you tell them to do immediately after this session?
Okay. So ideally, if you are an adult, I assume that almost everyone joining the call is an adult. You should have at least checked your eye almost once every year. Most people
Then
don't
we are
even
all
check their
at
eyes
fault.
unless they have an eye issue. Ideally, once in a year, you should have checked your eye.
Wow.
So maybe at the beginning of the year, you may not have signs of glaucoma, but something happened. Maybe you were diagnosed of a medical condition and you've been kept on some medications that may trigger some side effects that would raise your eye pressures. And maybe for a few months, then your optic nerve begins to die slowly. So if you've never had an eye test, at least once every year, but ideally twice a year.
Oh, okay.
Okay.
So this is my follow-up question. So Doc, if I walk into Robert and Son right now, if I walk to any of your branches, I understand you have a lot of branches scattered across.
Yes.
So if I walk to any of your branches tomorrow, what exactly will happen to me? Should I be worried, or it's just going to be a simple process?
Okay. So if you walk into any of our branches, it's routine that we check for glaucoma. Anytime you walk into any of the Robert and Sons branches, glaucoma test, the preliminary glaucoma test that I mentioned, is part of the test that we'll be doing for you. So it's a whole package. Once you pay your consultation and then you walk in for an eye test, even if you don't mention that you are checking for glaucoma, it's part of the test that we usually would do for you. So if there's the need to go ahead and do the secondary test, we will let you know, and we'll also tell you how much it's going to cost you to do the secondary test. But if you don't need the secondary test, we also let you know. So myself, for instance, when you walk in, I check for glaucoma. If you don't have it, I let you know that there's no sign of glaucoma. And even though there's no sign of glaucoma, it doesn't mean that when you come in next year, you may not have glaucoma. So whenever you walk in, I will check for glaucoma, the signs of glaucoma. If it's not there, I'll let you know you don't have glaucoma as of today. But it doesn't mean that if you come back in a year's time, you wouldn't have glaucoma. So the preliminary glaucoma test is part of its routine at Robert and Sons, regardless of the branch you walk into.
Okay.
Mr. Jerome, please, are you okay now?
I think I'm okay. I have one more question.
Okay, please add it to it.
Because it has to
before we
do with
finish.
the eye. It has to do with the
Yes.
eye. I want to know if the test is painful, and how long it takes. Because our eyes, even when you are walking in town and something just drops in your eye, you
Yes,
feel
yes,
it.
yes. You
So
can imagine the pain.
you can
Yes,
imagine. So want to know if it's a painful exercise or it's just something simple. So we shouldn't be
Okay.
worried. So when we are coming, we are prepared and psyched up that it's nothing that's
Okay.
going to cause any pain to our eyes.
Okay. So most of the tests that you'll be doing for glaucoma are painless. There's no pain. The visual field test doesn't come with pain. The OCT test doesn't come with pain. And the duration, usually the visual field test takes a little longer. So it can take up to about 30 minutes, depending on your cooperation. But at Robert and Sons, we have one of the latest technology. So now the test is taking about 15 minutes for both eyes. So about 7 minutes per eye. But we also have the older version that can take up to 15 minutes per eye, depending on how cooperative you are. The visual field test is a little complicated, but the OCT test, within 5 minutes, you should be done with that. For the eye pressures, there are several ways to check for the eye pressures. One of them being the machine blowing air on the eye. It's not painful, but sometimes it can be a little uncomfortable. But it's just like something falling on your eye and someone blowing air onto your eye. It's not a good practice though. Don't do it. So it's something like that. So if someone can blow air on your eye to remove a particle, that's what the machine does to check your pressure. There's also another version that something touches your eye. It's like it's going to poke you, but it's painless. Just that you see something coming to touch your eye. So at Robert and Sons, depending on the branch you go to, each of these machines are available. So at your convenience, then you get to choose which one you want to use, whether you want the thing to touch your eye or you want air to be blown onto the eye. But the procedures are painless. Sometimes we may have to dilate the eye. So we'll just put some medications on the eye for the pupil to open up, for we to examine the retina that's inside of the eye. And that can actually blur up your vision for a day or two, depending on the individual. Aside that, it's not painful. But even nowadays, we rarely dilate people because of the machines we have, because we have the latest technology. We tend not to dilate people often. So most of the time, you will not even get dilated. I see someone is asking in the comment section that, do we take insurances? Yes, we do. We take almost all the insurances that the private insurances, but we don't take the national health insurance. But almost all the private ones we do.
Yeah, private insurance, Premier, Glyco, Apes Health Insurance, Acacia Health Insurance, we take all of them. It's been listed in the chat, so you can check it and then do due diligence to your eyes, because early detection, trust me, is going to save you a whole lot of money and time, emotional torture, emotional stress, and
Yes.
the emotional stress alone coming with blindness, you have no idea. Especially
Definitely.
if you know that you've not been blind before and then all of a sudden you are blind. It will be
Yes.
painful.
So I actually have a patient that was diagnosed of glaucoma when he was in his 20s. And he was diagnosed by another doctor, but he didn't really heed to the doctor's advice. Back then, he thought it was a joke. One thing about glaucoma is that when you're on the medications, you don't see any change. It's not like you are having pain when you take your medications and you don't feel the pain. There's no pain already. So when you are taking your medication, you are not seeing any change. So people are usually tempted to stop taking their medications. So he stopped his medications. 10 years along the line, he's legally blind. And when I say legally blind, when he's walking, he can actually see figures, but he can't identify faces or maneuver his way around. This man is a big man. And when I say a big man, he's rich. He has a house and all that. And the last time I saw him, he was telling me he was going to sell his house because he can't climb upstairs. And whenever he was visiting me, he came with his kids. The oldest was about 10 years. And the older girl is the one that would order a ride for him to come to the clinic to see me. And he's traveled around the world. He was thinking maybe because we are in Ghana, we are not having the best of treatment. He's gone to Holland, Germany, and what have you. And his condition is still the same. He's gotten all the money he wants, but now he doesn't have good sight to be able to spend the money well. So once you are diagnosed of glaucoma, make sure you follow the treatment regimen. What he told me was that when they told him 10 years prior, he didn't really take it serious. He said the doctor didn't frighten him. That's the word he used. The doctor didn't frighten him.
So he
And
didn't.
sometimes,
He took it lightly.
yes.
Oh,
And we don't have to frighten you for you to know
yes.
much about the condition. Frightening you can also even affect your mental state. So we don't frighten you. But the reality is that you can lose your sight. And once you lose it, you don't get it back. So when you are detected early that you still have good vision, you can still go about your normal routine at work and at home. That's the time you're supposed to do all the right things. The moment you don't do the right things and you lose that vision that you have, then you don't get it back.
Okay, Doc, our time is almost up, but I see another question here. It will be our last question and then we wrap up. Apart from your reading glasses, do we still need a screen protector? Kofi Bismarck is asking, apart from reading glasses, do we need a screen protector for our phones?
Okay, so what do you mean by reading glasses? Because in our setting, when you say reading glasses, it's just some glasses that will magnify whatever you are reading.
Kofi, if you can just unmute yourself and then explain further so that Doc can help you. Kofi Bismarck, kindly, if you can hear me. Kindly unmute and then talk about it.
Hello.
Yeah, hi.
Doc is listening.
Hello.
Hi.
Hello, Doc is listening, please.
Can you hear me, please?
Yes,
Okay.
please.
Okay. Using maybe I didn't put it right by saying reading glasses, but we are using glasses. Okay, so is that also enough to set protectors for our eyes, or we still need to look for screen protectors like for the computers, laptops, and phones as well?
Well, so ideally, when you have the glasses that has the protection, you should be okay. But they always say more meat doesn't spoil the soup. If you have the glasses on and you still want to protect your computer with a screen guard, you can do that. But ideally, having the glasses on should be fine. It protects you from the rays from the screens.
Okay. Thank you.
You're welcome.
Abednego Blankson, please kindly mute for us. Okay. So those of us who don't know Dr. Osman Jr., a little brief about Dr. Osman holds a Doctor of Optometry degree from KNUST, obtained in 2019. In addition to his clinical training, he has a background in project management from project management professional, and then he has skills in healthcare planning operation, member of the Ghana Optometric Association, World Council of Optometry, Allied Health Professional Council, and Project Management Institute. So Doc is he has gotten time for us this evening. Doc, thank you so much.
Welcome.
Doc, thank you so much for joining us. I think we've
Welcome, and thank you for having me.
learned a lot. At least we've learned that a lot of stress and then save aside. And then once a year, Doc said we should try and then check our eyes. 40, and then all the signs and symptoms that he has taught us, even if you are not paying attention, from today, I think you pay attention to yourself. You know that, no, I need to go to, of course, there's only one place, which is Robert & Sons Limited. They are very, very good in what they do, and then it's affordable. It's affordable all over Accra. There are a lot of branches. We have the main branch in Adabraka, and then Osu, we have Kuforidia, we have Kumasi. It's scattered across Ghana, actually. So about 9 branches. And then when you go to the comment section, they've sent a link there that you can actually book online, and then they will give you a date, and then you'll be able to come. Yeah, your 10% discount is waiting for you. Book an eye exam now before you leave. We have 19 participants here. At least 15 of us should book our eye exam before we leave, so that at least Robert & Sons can help us, and then it will reduce cost. It will reduce cost, it will reduce stress, and then you'll be able to know what is happening to your eyes. Maybe it's not about glaucoma. Maybe it will be about something else. We all need a screening today. Doc, am I right? We all need a screening today,
Yes,
right?
we all do.
Okay. Yes, we all do. So thank you so much for joining. Abednego Blanson Samba, thank you. Abigail Thompson, thank you. Gideon Yusa, Hamda Lapegla, Isaac Kwashi, Junior Yusuf, Kafui, Ofebe Smack, Lewis Selby, M.A. Bimbang Bahamdia, thank you so much. Nana Sarah, thank you. Peter Kinope, and then Tammy Porter. Thank you so much. It was an insightful one this evening, and then we hope to do more sessions like this, and then to get more education on our site. So see you next time, and then thank you for staying with us. Bye-bye.
Thank you. Bye.